Good evening. I'm Joshua Gordon. I'm the chair of the Department of Psychiatry at Columbia and the executive director of the New York State Psychiatric Institute. And it's my pleasure to welcome you here to Navigating a Digital World, Youth, Technology, and Mental Health, a Hope Over Horizon panel discussion. I'm honored to welcome you here to this important and timely discussion on the new digital landscape and how this landscape is influencing youth mental health. We're joined today by some of the field's leading experts on child and adolescent mental health, depression, suicide risk, and teen digital media use. This is the third installment of our Hope Over the Horizon event series, which is made possible by support from the Saks Fifth Avenue Foundation. These events are dedicated to raising awareness and increasing public understanding of mental health, depression, and suicide risk. Our goal is to battle stigma and provide accessible information on what our patients experience, the current state of evidence-based mental health care, and what we're doing right now at Columbia to help our patients overcome mental health challenges. As many of you, all of us have seen over the past 5 years or more, a lot of attention has been devoted to the topic of social media and mental health. Some of it is informed attention. Some of it is uninformed rhetoric. We know that social media can influence adverse outcomes in our children. We also know that social media can serve as a connecting environment that help our children bond with each other and grow. What we don't know is how best to utilize, regulate, and understand these influences so that we can help children use technology for good and avoid the worst aspects of these technologies. Under the leadership of Dr. Randy Auerbach and Dr. John Mann, the Center for Prevention and Treatment of Depression is working to help us understand not just the role of social media in mental health, but overall the causes of depression, the outcomes of depression, and how we can lessen the worst of those outcomes. Through research and through offering youth-focused treatments for patients and for advancing new evidence-based therapeutic approaches, this center seeks to transform how mental health care is delivered and, importantly, how the public understands these influences and how the public can work to mitigate them. Every day, they're learning more and more about how to reach patients who are most in need, how to deliver care to those patients, where they are and when they need it. And that includes not only studying the impacts of technology as it is used now, but developing new digital tools, telehealth resources, peer support resources, and other means to harness the best aspects of technology. You're going to hear tonight from some of the clinicians and researchers affiliated with the center who are conducting this research and who are working every day on the ground with young patients to try to help them. We at Columbia are deeply grateful to the Saks Fifth Avenue Foundation for their robust support, not only of today's event and our other public outreach activities, but also for the research that we're conducting on depression and suicide. To date, the foundation has provided more than $1.3 million to Columbia researchers who are conducting pilot studies on these subjects. Those dollars have in return allowed those researchers to garner many millions more in funds from federal agencies and elsewhere to conduct this important research that you're going to hear about today. I'd also like to thank our many donors in attendance today who have supported the Depression Center and other initiatives impacting child mental health, particularly through supporting junior investigators who drive innovation and progress. And those of you who've heard me speak before know that supporting early career investigators is my highest priority as chair of the department. To begin today's program, I'm honored to introduce Dr. Randy Auerbach, co-director of the Center for Prevention and Treatment of Depression. Dr. Auerbach is the Irving Phillips Professor of Child Psychiatry. He's a leading expert in the field of child and adolescent mental health, whose research focuses on improving our understanding of depression and suicide among adolescents. And this includes research on the role of the adolescent smartphone use in predicting and preventing suicide. I'll say also, please give Randy a little bit of a break. He was up most of the night with an ill child and came here nonetheless to join us today. Despite that, the hardships of being a parent, his leadership and vision have been instrumental in advancing our collective mission. So welcome, please, Dr. Auerbach.
Yes. Thank you all for coming, and yes, I appreciate a little grace. I was up with someone who was in worse shape than I was from 3 to 6 a.m., but she's doing fine. This is an exciting event, in part because I think in prior years what we've often done is we've had really talented investigators and individuals in the public sphere present to you, and I think that this topic certainly lends itself well for a conversation with our community, the community with whom we serve. And what we thought would be important to discuss, as Josh has intimated, is that this is a really challenging topic that we're barreling head in towards. And we don't necessarily have a sound understanding of what are the boundaries that we should impose, what are the tools out there to support youth and families, and what are the truths and not truths of what's going on in these spaces. And I think part of the challenge, frankly, is that it's such a fast-moving space. You know, moving from smartphones to social media to chatbots, and in 6 months there'll be other endeavors and other doors that we're opening. Today, however, I think we're going to have an opportunity to speak with several experts in the field across the clinical and research domain. And the format of today's panel is that I'm going to introduce the panelists who have very graciously offered to indulge me with questions that I'm going to ask them. And what these questions are really meant to do is to certainly grease the meal, if you will, in the sense that I want you to ask questions. And so we're going to briefly go through some questions and answers, but our hope is really to engage you as the audience to help us understand what are the concerns that you have with regards to the patients that you're seeing, with regards to the children in your lives, because in many ways that spurs on the research that we do. So I'll start by introducing Dr. Colleen Cullen, who is an associate professor at Columbia and also the executive director of the faculty practice here at Columbia. Welcome and thank you.
Thanks. I'm really excited to be here tonight to talk about such an interesting and important topic, and I really see myself on this panel as the sort of the clinical voice. I really identify as being a clinician. My clinical work is primarily working with adolescents and young adults who experience suicidal and self-harm thoughts and behaviors. I'm really lucky to do a lot of my clinical work in a donor-funded adolescent dialectical behavior therapy program. And what I want to talk to you about are some of the opportunities and challenges that we see in this space in terms of what technology presents in the lives of youth. Similar to what I'm sure you all are seeing in your lives, there are real advantages and there can be some disadvantages as well. And so we're going to talk a little bit about that. I want to name that as we're thinking about these opportunities and challenges, there are a lot of factors that we want to consider in terms of the ecosystem of a particular child. Their family system and family values, the community in which they live, their unique characteristics and identities, and that will inform how we think about all of these different challenges and opportunities as well. So in thinking about opportunities, I'm sure a lot of folks have heard about the idea that there can be real opportunity for community for marginalized groups. So for youth who may not have the ability to connect with others, potentially with similar identities to them, whether that's LGBTQ+, potentially racial and ethnic minority individuals who might not have an available community, neurodivergent youth, et cetera. Going online, finding community can be a real resource for them and is a really important opportunity. There's also opportunities for social connectedness and feelings of belonging. So when we think about social media as well as other ways of interacting digitally, there is a social component that can happen. And part of how we might think about this is sort of like the active engagement that can happen through messaging or video calling that can supplement and help enrich relationships that youth have. And then there's also the idea that, we think about sort of the IRL, in real life relationships and online relationships, which are becoming sort of outdated terms in a lot of ways. But the idea that online relationships and connections can be real connections that are formed. Digital tools provide increased access to safety nets. So I mentioned my work with youth who are experiencing suicidal thoughts and behaviors, self-harm thoughts and behaviors, and having devices available gives them access to things that can provide support for them. So I am a clinician who, when I'm providing DBT, I am available to my patients. They can reach me through their devices. They might have an evidence-based safety plan to help them stay safe in difficult moments, and can have access to really important tools that can help them get through difficult moments without making it worse in some way. And then we also think about the idea that we can leverage digital data to better support physical and mental health. My research colleagues all around me can certainly speak to this in all kinds of ways, but we really are gaining more information on what sort of data suggests to us that youth might be at particular risk, and that's really important to know. And even in my everyday clinical life, the idea that we can use some digital data to better understand what are patterns for them. So if they notice in looking through the pictures on their phone that they didn't really do anything that week, and also they were more depressed, that might give us some insight as well. In terms of challenges, I have listed impact on sleep, and my note to myself is I feel like maybe enough said on that one. Just naming there can be all kinds of challenges on sleep, whether it's delayed sleep onset, phones in the bedroom, going to sleep later for all kinds of reasons, interruptions to sleep that are happening. Sleep is so important for all of us, and certainly for youth, so that's something we certainly want to be mindful of. I also think unrealistic comparisons and FOMO, the fear of missing out, is a pretty well-known phenomenon that we think about. One of the most important tasks of adolescents is identity formation. They are figuring out who they are, and part of how we do that is making natural and often healthy comparisons to others. When we are seeing curated lifestyles that don't present the full picture of what's going on in someone's life, that can be really challenging when we're trying to figure out who we are or how we're regarded by others. There are physical and digital safety concerns that can arise. I don't see this at all as a new phenomenon, and just to name to you, I am regularly having these conversations with the youth that I work with around safe online behaviors. What information are you sharing about your physical location? What kinds of images are you sending? What kind of information is out there? And also the idea of a permanent digital footprint, that things that you put out there, we don't know that we will ever be able to get them back in any way. And finally, cognitive distraction. As a clinician, I talk all the time with patients of all ages about the idea that multitasking is a fallacy. We may try and do more than one thing at a time. We don't do them as skillfully or effectively. So when we have our devices available, when we are frequently shifting tasks, I think we've probably all had that moment of you're working on a project and then an email comes through and you shift and then shift back. All the cognitive inefficiencies that go on can provide real challenges. We also want our youth to be able to tolerate a little boredom, not have something that they're doing at all moments, to be able to self-soothe without the use of devices. So that's another challenge we think of as well.
Excellent, and we'll obviously have more questions and thoughts on this later. Our next panelist is Dr. Paul Bloom. Paul is an assistant professor in our department. Paul's background is interesting in the sense that he is a cognitive neuroscientist by training, but in his earlier postdoctoral work had pivoted to really trying to understand the adolescent lives of the digital spaces, which is inclusive of smartphones, social media, and more recently chatbots, and he'll provide more insights into these worlds.
Sure. So yes, I'm really excited to talk about a lot of our work and get our feedback on our work, which is really, over the last few years, has been thinking about how do we define the digital space that teenagers, or really people more broadly, are in, And maybe many of you came to this event thinking we're going to talk about social media. And I think, number one, social media has been hard for us, even within our group. We can't even define exactly on an agreed term of what is and what isn't social media. And it's very complicated, and it's been changing over time, and it will continue to change over time. So thinking about what is and what isn't social media, but also the broader digital world that teenagers are living in beyond just social media. So I put up on this slide many examples of things that teenagers could do in the digital world, which may not be the first thing that we might think of, but these are the types of things that we are studying that they might do on their phones, on their laptops, on other digital devices that are beyond social media. So watching Netflix, doing their homework, applying for jobs, doing academic work, chatting with their friends, having a phone call with their parents, or much more recently, using AI and chatbots is an emerging topic that we're really working on studying a lot and trying to understand all these different aspects of the digital lives of youth and how that corresponds to changes in their mental health, whether it's beneficial or harmful. Can we go to the next slide, please? And so a lot of the methods that we use in the lab, I just wanted to give you a brief overview of the tools that we use, because we see that these digital platforms in many ways can be a portal or a window into understanding the lives of youth and understanding their mental health in a lot of ways that we wouldn't be able to if these digital tools did not exist. So for example, we might give teens surveys that they can fill out on their smartphones. And the advantage of doing things like this is they could fill those surveys out repeatedly over a period of time to track their symptoms or to track things that are positive or negative in their lives. And this allows us to get a much more sort of real world picture of what's going on from day to day than they might be able to tell us if they were just recollecting on those things in one visit to the clinic or one visit to the lab. Now, those surveys might be a burden or might take effort for those teens to fill out. So we've been trying to come up with methods, and these are methods that Randy and others have sort of brought and pioneered to the field to be able to understand digital worlds without having adolescents need to respond to many surveys. So for example, we use what we call smartphone sensors, or leveraging the data that are already collected by phones to try to understand things about behaviors, emotional states, and mental health. So we could track things like their GPS, where we could understand how much time they're spending at home or in other locations. We could track their sleep, which Dr. Cullen has also mentioned has been a big priority. We can track usage of different apps. We can track things like what kinds of language they're using, which might tell us not just their behaviors, but the types of things they're thinking about and the types of things that teens are communicating in a social world to other people about. Most recently, a lot of the work that we've been doing in the lab has been on the right side of this slide, looking at social media data and looking at AI chatbot data. And the methods that we use, we call data donation. And the reason is that we basically, when the teens come to our studies, we ask them if they're willing to log into their accounts on these platforms, so social media apps like Instagram or TikTok, or AI chatbots like ChatGPT, and download their own data, and if they're willing to, donate it to science by sending us their data logs, which of course include many things that are incredibly sensitive and incredibly private, and we take that very seriously, and we make sure to protect the data and anonymize it as much as we can and keep it under safeguards, under as many standards as we can. And what that allows us to do is really get an in-depth picture of many of their interactions, many of the types of different content that they're exposed to on different platforms. So for example, what are they scrolling? What are they browsing on TikTok in their social media data? We can start to see that through these kinds of logs that we get. And in the past couple of months, we've started studies where we also get these same logs with AI chatbots like ChatGPT, Claude, Character AI, where we can see what participants, what our teens in our studies have been saying to chatbots and what the chatbots have been saying back to them. And so in many of our studies, what we've been doing is looking at what is happening in these digital spaces and then comparing that to the clinical assessments that we're doing in the lab over periods of time to understand not just who is at risk for suicide or for depressive episodes, but what are the features that are happening in these digital spaces that predict changes in symptoms over time or the onset of an acute depressive or suicidal crisis, and what might be warning signs or things that we should look for to build interventions or to build safety policies into platforms that we could look forward to in the future.
Excellent. Thank you, Paul. Our last panelist is Dr. John Mann. John has a towering presence in our field across depression and suicide. John is the the Jansen Professor of Translational Neuroscience in our department, and his work in the field has spanned basic science to human work, and has impacted our understanding of the phenomenology of depression and suicide, but also advancing different approaches to prevention and treatment. John?
Thanks, Randy. I'm going to see how well I've memorized my slides. Over the last 20 years or so, we've observed in the United States a progressive increase in the rate of suicide in the general population, a phenomenon that we really do not understand the cause of, which is pretty alarming. But the suicide rate has gone up about 30% plus in the general population. Over time, there's been an increase in suicide rates, increasingly in young people relative to older people, increasingly in younger adolescents compared to older adolescents, and now increasingly in children compared to older adolescents. Each of these curves have taken off slightly after the other one. And this has raised a sense of alarm amongst healthcare professionals who track these things. And then layering itself on in time-wise most closely with the rise in suicide rates amongst adolescents, particularly younger adolescents and now children, has been the increase in screen use. Different digital platforms, social media use, gaming, etc., online gaming. And this has raised the question of whether there is a relationship between these two sets of phenomena. And as Dr. Gordon pointed out in his introduction, this has led to a certain degree of speculation, sometimes by very senior figures throughout the country in the healthcare space, but sometimes in the absence of real data connecting these two phenomena in some kind of causal fashion. So what we have devoted ourselves to do is to try and understand what is the relationship between these developments. So as you see from this slide, there has been a phenomenal increase in the use of mobile phones and social media by young people. What this slide also shows you is that the usage by the general adult population, particularly skewed towards the younger end of the general adult population, has also been massive. And what we find when we talk to parents is that the parent is happy to talk about the problem of what's going on with their children in terms of screen use. But very often the parent will say, you know, actually I have the same problem. And so that raises other questions. But certainly screen use amongst children is off the charts. In this slide, we asked the question, because actually, and we were discussing this before we started tonight's program, the statistical relationship between screen use, social media usage, etc., the amount of time, and mental health outcomes is rather weak. And the effect is not very strong. So we then used this very important data set from this massive US study that's ongoing called the ABCD study that involves about over 11,000 children throughout the United States, to ask the question, maybe it's not total time of usage that matters. Maybe it's how the kids use their screens. And if you're a parent and you have little children who watch, stuff on, their screens, and then you tell them time's up, and then the kid gets really angry and annoyed and there's a whole long negotiation, you know how difficult it is to terminate and stop this. So what we found using ABCD data, that at the age of 11, a huge proportion of these kids were already addicted to social media use, mobile phone use, or gaming. There is no other thing that kids are addicted to in these kinds of proportions. And the reason isn't entirely clear, but one obvious reason is availability. The second thing is that we were able to track these trajectories and found that these kids stayed in these trajectories over a long period of time. ABCD data now, we have 5 or 6 years of outgoing survey data. And they go into these 3 trajectories and they stay in it. The addicted group stays addicted. There's a group that's increasing, you see, become addicted over time, and a group that seems to be somehow resilient. But that means that at age of 10 or 11, we can start to try and figure out a lot of things. Who's already addicted and needs help right now? Who may become addicted and maybe we can prevent that happening? And who doesn't need our help because they're not going to get addicted? These are 3 very important questions. Not only that, by studying these kids at age 10 or 11, we can study their brain with all the brain imaging that's available. You know, I'm a professor of translational neuroscience. That's really what I do. So we can image kids at the age of 10 to see what established addiction looks like in these kids. We can see what it looks like in kids that will become addicted but are not addicted, and kids who will not become addicted. These are incredibly valuable data set. We're going to learn a huge amount from all this. We've already learned a huge amount, and I'm not going to tell you all about it. But you can see the importance of this from prevention, prediction, et cetera, And in the last slide, you can see some of the associations that were found with these addictive trajectories, many of which are sort of predictable. You know, if you have a family in which suicidal behavior is going to run, then you're more at risk of that kind of outcome. If you're a boy, you're more likely to get addicted to online games. If you're a girl, you're more likely to get show addiction behavior related to social media. But I want to emphasize something really important that Colleen told you. Not all of this usage is bad. We now find that some elements of usage are therapeutic. These kids are using it in a positive way. Sometimes they're using it, it's part of they're doing their homework, they're learning new stuff that they didn't learn at school, which is creative, interesting, important. They're finding social networks that they lack in other settings, and so on and so forth. There are good things that they're doing. And then sometimes there are things that are not good. But being addicted to anything is generally not good. And what is the worst outcome that we find with this addictive behavior, proportional to its severity? It's an increase in suicidal behavior. That increases over 3-fold in the already addicted group, and then an intermediate amount in the becoming addicted group, because they have to reach a certain level to get into a dangerous zone. But an over 3-fold increase in this age group in suicidal behavior is a very serious marker. And it's a guide to where we need to focus our attention, research attention, to figure out what are the pathways that lead kids to become addicted that early, and then go from addiction to suicidal behavior, which is exactly what we're very busy doing now. Thank you.
Thank you. So I think what this brief overview highlights is that teens are interacting with their digital devices and their digital world in different ways. And I think for some of those individuals, that broad use may confer some degree of risk. And at the same time, for some individuals, and I think the challenge here is we don't know who those individuals are, it may connote some protective factors. Colleen, in your work directly with families, and certainly this comes to our door in some of the research that we do, is that parents and caregivers have lots of questions. And I think one of the chief questions that are presented to us are, what can parents and caregivers more broadly do to help teens and young people navigate and really furnish a healthier digital space?
Sure. I mean, I think starting with the idea, and this comes up so much in parent engagement with youth, is starting with curiosity. So trying to better understand, I think so much of what we're saying tonight is, having access to technology is not good or bad necessarily. We want to understand how it's being used. So having a better sense of how they're using technology, what they're getting out of it, and what it looks like for them. Certainly one of the things we think about a lot with parents and their interaction with their kids is modeling. So one of the things to certainly be mindful of is modeling the kind of behavior around devices and technology that you would like to see in your children. The idea of do as I say, not as I do is sort of a complicated concept. And that could include things like, of course, putting their phones down at certain times, having screen-free time for the entire family can be really important, and also thinking about dialoguing with their kids. So to understand, when do you know that you're done with your time online? How can you get a sense that you're ready for a break or you're ready to do other things? We also think about the idea that the American Academy of Pediatrics talks about the idea that devices and technology can sort of crowd out other activities, and so thinking about how do you crowd those back in. So there is room for all kinds of online engagement, and also what about sports, playtime, being able to be outside, be with friends without devices?
Thank you. I think you're highlighting these really important points about, unsurprisingly, caregivers often are the pace car, so to speak, and the extent to which it starts to intrude in their life and establishing good boundaries in their own practices is helpful. It's interesting. I think almost organically we kind of zoom in and out of this, and it seems to kind of sit where people almost equate digital devices to social media. But in Paul, in your work, I think that you're very elegantly getting a more intrusive, by design, perspective, that in your work you're able to scrape off the phone and see where they're spending their time, how they're spending their time, and in that way, screen time isn't this monolithic entity. And I'm curious the extent of what are you observing in how teens are interacting with technology, and how are you seeing that change? And lastly, what are the implications of that change?
Sure. So I think when we talk about scraping what's going on in their phones, one of the primary methods that we've been using for the last couple of years is looking at when teens type things in their phones and what apps are they typing those things in, and what is the context, the content of what they're typing, what does it mean? And when we look at the totality of that, the most common by far sorts of typing is in apps where they're sending messages. And that could be, text messaging, SMS, or iMessage. We do see a lot of messages sent via social media apps. And so that sort of contradicts maybe one of our stereotypes of what might be happening on social media, that you're browsing or you're posting something. And what we see actually in the last couple of years that has really, really increased is what's called DMs, or direct messages. And we see a lot of conversations in these direct messages, which basically resemble text messaging. But direct messages in Instagram are very, very popular among teens. And to a lesser extent, there's direct messages that teens can be sending on TikTok and on Snapchat especially. That's another very, very popular one. And each of these apps have different features and different ways that the context of those messages, how long they stay there, who can see those messages. For example, on Snapchat, things that you send to somebody else disappear. And we've talked to teens who say, well, all the toxic stuff happens there, all the cyberbullying and things like that. That happens on Snapchat because there's no record of it. And if you take a screenshot of those apps, it alerts the partner that you are talking with that you have taken a screenshot. And so in certain ways, teens feel that disincentivizes any sort of accountability or reporting for toxic behaviors. So all of these different ways are different places where we see teens interacting, some of them which align with the sort of traditional definitions of social media, and some of them don't. What we've been doing most recently is trying to understand how teens are talking about suicide itself on many of these apps. and trying to pull out across all the texts that they're sending on their smartphone instances where they're mentioning suicide or suicide-related topics, and to understand of which of those instances actually confer or indicate that the teen is at imminent risk for suicide. And so we're aligning those messages of when they might be talking about suicide to the clinical data that we're collecting on a day-by-day or week-by-week basis in efforts to understand, are there certain types of messages that they might be sending, whether it's in a text messaging app, whether it's in an Instagram DM, or whether it's something they're writing on their own notes app on their smartphone that isn't actually sent to any other human being. Did any of those types of messages predict when they will report clinically significant suicidal ideation that might require a clinical immediate intervention? Does it predict when they might make an emergency department visit or a suicide attempt? And so we're just at the beginning of that process, but we are starting to see that certain types of language we think do show those predictive signals, but they're not particularly strong because a lot of what teens are doing when they're talking about suicide is making jokes. And it's very hard for even us as adult readers of these messages to understand when a teen is joking versus being serious without the full context of that conversation and knowing exactly who they're talking to and what they've talked about in the past. And so we think this work has a lot of implications for the monitoring that's happening of teens' text in schools, where, for example, school systems are monitoring teen devices and trying to understand what they're talking about and when suicide-related interventions need to happen based on conversations there. And the work that we're doing highlights the challenges in doing that there is some signal there, we think, but it's very hard to know when intervention is required, when should that happen, what should the intervention be, and is it worth the cost of the intrusiveness, as Randy mentioned, of doing that monitoring itself.
It's been kind of interesting in this regard because I think the task is made harder because there's adult readers. And in fact, when we had a number of really talented undergrads working in our lab over the summer, it was almost they were the Rosetta Stone, and they could tell us, this is actually what this means, this is not what this means. And so we're all speaking the same language and we're all writing things, but it seems like we're not selling the same story.
I've never felt older than in those moments.
I think what's very interesting in this, John, your paper spoke to this idea of big data, and we now have these pretty extraordinary natural experiments that are ongoing within the US in terms of school-related smartphone bans, or in Australia at a more substantial perspective in terms of limiting access to social media for those under the age of 16. And I'd be curious to the extent that if you have any thoughts on this, as to what do you think we'll find, or are there any potentially unintended consequences that we really haven't thought through? And the reason I say unintended consequences, I think that a lot of the dialogue at a national level has been driven by popular scientists who aren't necessarily doing the work, and at times have a pretty casual relationship with causality. And I think that it's not that I believe that the boundaries that they're suggesting may be wrong, but the conclusions that they're drawing are not supported by the data at this point. And so I'm curious how you think that that'll impact some of these natural experiments.
That's a very serious question. Thank you. By the way, Randy's referring to a paper that we published in JAMA, which you can get copies of at the back.
John will sign them too.
Anyway, but you can tell from my accent, I'm from Australia. Maybe you can't. Australia has this sort of pioneering role in banning social media accounts on social media platforms for kids under the age of, I think 18 or something? 16. And it's about 3 months that this has been going on, and so everybody's been asking them, how's it going? And is this working? Of course, they have no idea. And we're not going to have a good idea for a while. But I can tell you that mining these data sets that we have here at home in the US is informative. It seems that certain types of, apropos what Paul is saying, certain types of screen use, social media use, phone use is constructive and is actually potentially therapeutic. And this is a more nuanced view of the problem, and we're not in an era where nuanced views of anything are tolerated very well, but that's the fact. So we do not want to throw out the baby with the bathwater, and we need to look at these things very critically, and we need to understand what is the transition from use to pathological use, and what is the transition from pathological use to mental health consequences. And we're only now beginning to put some of those details in place. But we're only at the beginning of this process. So it's early days, and let alone design a prevention program that is evidence-based. We don't have the evidence fully worked out. So working out the prevention plan is also a bit premature. But nevertheless, New York State is spending over $100 million working out ways of storing kids' phones during school hours. But we are not entirely sure how that's going to help and who it's going to help. And it's certainly, there's a group that doesn't need that kind of help. And then there's another group that is dependent on the phone for a certain amount of help. We need to figure a lot of things out before we rush headlong into dictating solutions.
Thank you. I think that reminds me of a question that I'm curious of your thoughts on, Colleen. It does sound like, to some extent, there are some people for which this digital space can be helpful, and I'm curious. I could even imagine if there is this type of limitation, it can impact clinical care, and I'm curious, when and where possible you see some of those digital data actually informing and supporting some of your treatment initiatives.
Yeah, it's a great question. And I think that there's where we are today and where I imagine we might be in the future. So, outside of participation in research studies, as a clinician, I don't have access to this sort of treasure trove of digital data. I think that may be part of what we do in the future. For right now, over time, I think I've really changed my clinical practice and the way that I assess the lives of the youth that I'm working with. So there's all kinds of rich data that I can get from youth that I find really informative. I think mine is sort of like a limited data dump data donation they may give to me. But instead of just telling me about the conflict that they had with their friend from their perspective, if they are an adolescent, it happened on a device, they have all of the messages, and they'll show it to me sometimes or read it, and we can talk about it a little bit more objectively of not just from their perspective, why might you have responded in this way? I mentioned before, I work a lot with adolescents struggling with suicidality. I've had patients hand over their phone and show me the chat that they had with 988, which is the Suicide and Crisis Lifeline. I can see exactly what was going on for them in that moment. So I'm finding that, with certain situations in youth, and assuming they're willing to share some of this, I'm getting a fuller sense of what their lives are. And the good stuff, too. I see the pictures of the really fun birthday party that they went to and the person they have a crush on, and, all of those kinds of things as well.
Thank you. And Paul, I think that you have this you're at the fore in many ways of, there's a lot of obviously discussion on social media, but I think increasingly in the news we're seeing the presence of chatbots in people's lives, and I'm curious as to, I recognize you're in the early days of this clinical research, but what are your thoughts on how they're interacting with that space, and what are some of the promise and perils of that space?
Sure. So I know you said we're at the fore, but in thinking about how things change over time, it feels like we're already behind because of how fast AI is changing and how these platforms are changing over time. And so, for example, we've just started a study as of January where we are having this data donation where teens can choose to send us their chatbot logs. And right now, I think 5 teens in our studies, these are teens who have visited the emergency department for suicide-related concerns, whether it's an attempt or suicidal ideation. And so when they've come out of the emergency department, they've joined our studies and enrolled and decided to share their chatbot data with us. And so of these 5 teens, we've looked at, just started to do some preliminary analyses of what's going on in their data on these chatbots. And what we see is a lot of variability. Some teens are uploading just picture after picture of their homework assignments and not even saying anything to ChatGPT, and ChatGPT is doing their homework for them. That was probably the most common thing we've seen so far. We have seen things that are somewhat more serious or concerning to us about teens asking about risky sexual experiences and getting advice from ChatGPT on that. We've seen teens asking chatbots about how to break up with a partner who they are worried about might attempt suicide when they break up with them. We've seen teens disclosing their own depression or suicidal thoughts to chatbots. And we've started to kind of look at those responses that they're receiving from ChatGPT or other chatbots. And we're starting a study where we're looking at evaluating that from the perspective of, if Colleen were looking at that, how would she evaluate that in terms of, is it aligned with clinical best practices? And so we're going to have a team of clinicians and create a manual to understand, how often are chatbots giving harmful versus helpful feedback to these types of questions, and in what situations are these chatbot interactions happening right before a teen is going to the emergency department for a suicide-related concern, and if there are certain types of conversations that we can link to these suicide events that might be particularly relevant. We think those types of analyses will hopefully inform questions related to what should AI safety look like and what types of features should platforms have, as well as how can we think as clinicians or researchers about these platforms. But the reason I say it's slow is by the time we have finished our study, probably the chatbot landscape, and there'll be a whole new AI and a whole different model. GPT is swapping out their models as we go. Some of the platforms we study, for example, Character AI, they just made it so that teens, minors 18 and under 18 cannot use that platform anymore. And so we were starting to collect data on that, and now we don't know whether any teens are getting by those regulations or not. We're still going to look for it if that's happening, but it's just an example of that. It's a very rapidly changing landscape, and so we're trying to keep monitoring that. And one challenge is having our studies be flexible enough to account for what is happening most recently, and to keep up with those changes and understand them as they happen, while maintaining the rigor and consistency of everything we're doing in the research that we've done so far.
Excellent. So I think one last question before we open it up to the audience, who likely have many related questions. I think that John, in your paper, and I think that this is something we're seeing in the broader literature, and I think this is confusing for people, not your paper. Your paper's crystal clear, I promise. Is that the same term is there's a variety of terms being used. There's problematic use, there's excessive use, there's addictive use, and some people use the term addiction. And I think that those terms, at times in the literature, connote the same thing. At times in the literature, they connote different things. And I guess, how would you help our community understand what those terms mean and how they're being applied in your own paper, but also across the broader literature?
So, first of all, in terms of the way we went about this was we looked. One of the disadvantages of looking at these data sets is that you have the information that other people decided to gather. We didn't design this study at the beginning to answer the questions that we're trying to get answers to now. So we have to work with what they did. But they showed a lot of prescience in terms of what they decided to do with ABCD. The kids are now about 17, 18 years old, about 18 years old, going on. And so at the age of 10, which is when they did the baseline assessment, now that's a long time ago. And the whole sort of mobile phone use and social media usage was not really clear as an issue at all at that time. But addictions in general, but people think of substance use disorders. People get addicted to substances. But of course, there are other types of addictions, as you know. And this is one of those. But the kinds of stigmata of addiction tend to be similar across all of these different areas, whether it's a drug or whether it's a behavior. And so there's an excessive amount of manifestation of that. There's maybe a recognition of this excessive amount. There's a struggle to try and reduce the amount. There's a recognition, or maybe limited variable recognition, of the amount of damage that this excessive usage is causing to the person socially, educationally, economically, relationship-wise, and health-wise, exercise, displacement of other important activities, etc. And there are efforts to try and cut down usage in the light of that. And all of this can be scored on a little rating scale, and believe it or not, ABCD researchers were smart enough to have this for mobile phone use, for screen use, and for gaming. So we had all of those data, and we just scored the degree. And we came up with a sort of an arbitrary number which seemed like a lot. And that's what we called addictive-like behavior. And we can look at this, do they fall across that above that threshold or below the threshold, or we can just look at it as a continuous thing. Either way, you can come up with these kind of three trajectories that I showed you before. And the most serious outcome with the biggest increase was suicidal behavior. Interestingly enough, other things like depression, anxiety, anger, aggression, impulsiveness, all of these other things, the impact on that was less. Don't know why, but it was. So maybe having some of these other things plus addiction for some kids is really bad. And the place it's worst is in this suicidal behavior. And we don't know why, right, as we're sitting here. But we're working hard to try and find out the answer to that.
Thank you. Yeah, so maybe this is a good time to open up to the audience to see who might have questions about this space. Please. I think that someone will bring you a microphone. Oh, sorry. You'll be next, I promise.
Thank you guys for a fantastic panel. I found it really, really interesting, and it's so great to hear about all the wonderful work you're doing. John Mann, for the work that you're doing and the paper you published, I was really interested whether there were any patterns that you saw in the individuals that tended to be more highly addicted, either in demographic factors or other factors, and then also wondering whether there were similarities in the kinds of things that they were becoming addicted to, like certain platforms or other things, because kids have been watching TV and having high levels of screen time for some time now, but this really appears to be something different that's unique to some of these different novel platforms and ways that we interact with media.
I guess you probably actually asked quite a few things, but there is a tracking. People who use a lot of social media aren't automatically the people who are necessarily showing the most phone use. And the pattern of usage on these different platforms is important as well. Because on the phone, you have many different things that you could be doing that have nothing to do with social media. So that's important. We do see some patterns. For example, as I mentioned earlier, women tend to be more engaged with social media than disproportionately, and get addicted to social media, show higher addiction rates with social media than males. And then gaming is definitely a sort of a male thing. But there are other differences as well. For example, parental supervision matters, and the and how intellectualized the parental supervision is. For example, perhaps that encourages kids to use their mobile phone, for example, more for things like AI use for their homework, or just to learn about the world and other things in the world that they're not taught about in school that they're curious about, because it's a tremendously powerful tool. Even some of us older people in here, AI is an incredible multiplier of what you can accomplish in a short period of time. So no wonder everybody's, doing that. And of course, we've also looked at the therapeutic side of this. For example, there are wars, and some of us have been looking at tried treatments, for example, for PTSD. And to provide cheap healthcare to a lot more people, one of the ways of doing that is Wi-Fi and your phone. So we turn the phone into a therapeutic instrument. But the best way to get people to engage with programs that are good for things like treating PTSD is to work with gaming companies, because they can design interfaces that are attractive, interesting, engaging, and improve adherence and to the therapeutic app. If we do that, the apps are boring and there's very poor adherence. But work with these gaming companies in a constructive way, and you can have so I think that just gives you a flavor of this sort of the good, bad, and ugly of this situation.
I think, I think.
Hi, thank you so much for sharing all of your insights and expertise with us tonight. This question goes to both Paul and John. I'm curious, in your studies, if you've noticed any trends amongst marginalized groups that are a bit different compared to kind of the total observations you've seen.
Sure, I can go first. So, I mean, the largest finding that we see in terms of marginalized groups tends to be in terms of online victimization, and that sexual and gender minority youth and Black and Hispanic teens, this is some data from some of our collaborators, David Pagliaccio and Randy's work from the ABCD study, the same study of about 11,000 children and preteens that was mentioned before. The teens that were experiencing the greatest online victimization tended to be the teens that had the most marginalized identities. And so the amount of exposure to these experiences, online victimization, harassment, things that we think would likely be harmful both online or offline, the biggest effect that we see is just the level and frequency of exposure. So far in the studies that we are running right now, we were collecting data, and right now we don't have enough data necessarily in these smaller cohorts to know whether there are specific experiences that would predict adverse mental health outcomes in one population and not in another population. I can't say that based on the research that we've done in the smaller studies right now, but it looks like from our perspective, the main factor is just the blunt greater exposure among teens with marginalized identities to some of these more harmful experiences. The other thing that I would mention along these lines is we do see this is more from self-reported data from large surveys, from population surveys and such, that teens with marginalized identities are more likely to report using social media and other terms of digital sources to seek connection and community if they can't find that connection and community in person. So for example, a lot of sexual and gender minority youth who are not in affirming households or affirming schools report finding those support systems through digital means. Those are probably the two observations that have most struck me from our work, but I don't know if John, you have things to add there.
No, I'd agree with that. It's the problem is that we also see that households and families that are damaged and depleted. Also, the outcomes in kids who come from those situations are not as good. It's not a surprise. Everything sort of stacks up against kids from those backgrounds, and you can see that playing out in these data sets.
One interesting aspect that speaks to a little bit of what your question highlights is increasingly in the U.S. and certainly around the world, there's weather-related disruptions, whether it be flooding, fires, that has caused tremendous displacement. That displacement disproportionately affects lower-income communities, particularly communities of color. And something that's been interesting is the degree to which technology broadly, at times social media specifically, but even things like WhatsApp, which fits in this world of not really social media, but it's not really not. And for those children who have been displaced, separated from their peers in schools and having to move great distances for their community because their communities have been destroyed, it's been a place to congregate, actually, to stay connected to people who you've been separated from in a pretty powerful and often an abrupt fashion, and had to resettle into a community where often you're a stranger amongst your peers. And I think that I think what has come up many, many times throughout the conversations is that there are these unique opportunities where we could use these digital tools to really promote well-being. And I think that if we had a better grasp on for whom this may be helpful, I think that the good that we could provide is substantial.
My question is about the precautionary principle. So we have this idea in public health, right, that sometimes we take action even before we have all the data, right? So sometimes, we've had, all kinds of toxins, we study them, we don't know, does this toxin cause this disease? And we say we're gonna ban the toxin even before we have the causational data. And I'm curious about this in terms of social media. My research interest is digital mental health policy, so I think about this a lot. And we have, the bellwether KGM versus Meta case right now in California. We have everything going on in Australia with the age limits. And so, it really brings on the question, right? Like, the legal world is moving forward with this faster, it feels like, than we in the medical world and we in the policy world are. And so I'm curious, particularly, Dr. Mann, you mentioned we don't have all the data, right, for some of these preventative measures. I would love to hear from each of you, from clinical and research standpoint, where are we in that, and where should we, people interested in this field, how should we be communicating around when will we have that data, or what do you feel like we do have the data for, if any action, any kind of policy level? Thanks.
Great question. I don't know who wants to tackle this first.
I can start with the clinical piece, which is to say, as a clinician, I don't know that I need to see all of the data yet to have a really informed discussion with my patient. So to talk about with them, and again, we're thinking about these unique ecosystems for each person. Where are you finding it to be helpful in your life, and where are you finding it to be challenging? And let's really talk about that for you. And I think going in with the idea, certainly as a clinician and an adult working with youth, that I'm not assuming it's bad, I'm not saying it's all bad. I recognize there's good aspects of this. Where are you starting to see some problems, if there are any? What are you motivated to change, and how would you want to change that? So, there's lots and lots of discussions that go on around sleep, as I mentioned, right? And a lot of youth will own up to that, certainly. Or, the idea of if they are the scrolling types, like the mindless sort of scrolling that's happening and what that is crowding out in their life. So that's the way I think about it, is really being able to talk about for this person, where it's a huge part of your life, where are you seeing it as helpful and where are you seeing it as harmful? What are your goals?
Paul, any thoughts?
Sure. I think this is a really hard question, and I struggle to give a satisfying answer to this question because I am a scientist, and making decisions based on data seems so core to my, identity and thought processes. But one thing that I'll say from our research and experiences is that one of the reasons that we do not have the data that we need to make these decisions is that it's just been so hard to understand what's happening online because of the imbalance of who has ownership and access to that data and who has the power to give their data and who has the power to see the data. And right now, one of the biggest challenges that we face time and time again is that it's really, really hard to study things like social media and AI and different kinds of digital spaces because the companies that run those platforms are not transparent about sharing their data, and it's really hard for us as scientists. Sometimes we feel like we're just trying to design ways to collaborate with individuals and teens and citizens to get around their policies so that we can start to actually understand what's happening on those platforms in ways that we haven't been able to understand before. And so I think one answer that I might have to your question is that as features and new platforms are rolled out, that one thing that I would want is for those things to be designed with transparency and oversight from independent bodies, not within those companies themselves, so that the science can happen as the technology is being rolled out, and that we have better ways to study things quickly as they're happening and not be responding 5 years after we start to get data on things that have happened for a platform that's been out for a while already.
I want to take off from what Paul just said. First of all, one of the things about Columbia Psychiatry is that a lot of us who are mostly interested in the biology of the brain are often also taking care of patients. So this gives us a somewhat more pragmatic vision of how to answer your question. And obviously, if the patient or the kid or your kid or somebody else's kid or whoever you're talking to says they have a problem, that's an opening to try and do something about it. Because, of course, as you know, those of you who are parents, you think the kid has a problem, but they don't. That's not an opening necessarily to try and achieve anything. And adolescents are very challenging to parent. If you think your pre-adolescents have been challenging, you haven't seen what life is like when you're trying to parent an adolescent. Nevertheless, if you are in a situation where either as a clinician and a patient or a parent and your kid or something like that, and the kid is having a problem, then you can try and begin to address it in a pragmatic fashion, like what is the problem, what do you think's behind it, how can we try and deal with it? And now you can have in the back of your mind that this is a bit like an addiction, and maybe that's the aspect of it that I need to be thinking about, and how do people deal with things that they're addicted to, because that's often how the person who's overusing and seeing healthy things crowded out by pathological things feels. So maybe that's a way of sort of approaching it. Paul raised a really interesting thing, that we are seeing an acceleration of things happening in our lives. Everything is happening faster than it used to. Look what happened with COVID. We had to develop vaccines for COVID much faster, years faster than we ever developed vaccines before. But we rose to the task. We did that. We developed better vaccines. Those COVID vaccines are better than flu vaccines. I feel optimistic that we can do the same thing. The phone is a wonderful tool, but it has some side effects and threats. We need to understand both of those aspects, and we need to do what Paul suggests. As soon as some new approach in AI or digital social communication arises, we have to get on this immediately, understand how it works, understand its impact, collect the data in real time, because we don't have the luxury anymore of waiting for things to become manifest and then go after them and try and figure out what's going wrong, because nobody has the patience to wait for that process anymore. So hopefully that's going to happen.
I think
Just a fabulous panel. Thank you very much. I think I was interested in Dr. Jonathan Haidt, who's made himself the world's authority on social media. I just saw him on Fareed Zakaria, and he said it's all terrible. I was interested in what the panel thought, and what's the difference between the data that he has, which he says so authoritarian, he's correct, and what you people feel, because he's missing out on the fact that social media can help certain groups.
Well, it's a complicated question.
Yeah, I know, but-
Jonathan Haidt is someone who makes much stronger claims than I feel comfortable making based on my reading of the data. And I think most of the scientists that I speak with agree with that, that he's making very, very strong claims. And basically his thesis is that social media is extremely harmful for everyone, but particularly for teens. And he supports the ban of social media in Australia and in other places as well. My read of the data are that they are really much more mixed than Jonathan Haidt's read is, and that there are, as we've been talking about, there are positives and there are negatives, and we're working on trying to identify the specific things that are positive and the specific things that are negative. Haidt has been recently speaking a lot about the idea that there are these experimental studies where they randomly assign people to stop using social media for a period of time and randomly assign other people to keep using social media. And he's been saying that this proves that there is causation that wasn't there before. That is not literature that I'm particularly familiar with personally. It's not the type of research that I do. And so I can't speak to that with certainty. But it seems like there are mixed results from those trials as well. And I think some of that information is still, someone mentioned the court cases with many of the largest social media companies that are ongoing. That information about what happened in those trials and what happened in the internal trials of those companies, that is still being, I think, brought to light in litigation, and we don't have a lot of information on what those data actually show yet. So I think hopefully we will learn in the next few months or few years more about this and be able to make those sort of data-informed decisions that we were discussing before.
Excellent. So I think maybe with that, John will have a few closing remarks.
Thank you, Randy. Few is the operative word. First of all, I'd like to thank Randy and the panelists for this incredibly interesting conversation. I hope you all enjoyed it. As you heard, this digital landscape that we're looking at is evolving rapidly. One would probably predict with confidence that the digital landscape will be somewhat changed by the time next year rolls around. So maybe we'll have more to say about it at that time. I also want to thank the Saks Fifth Avenue Foundation. They've not only supported this program, but they've also supported these pilot grants, which our junior faculty have conducted. Each one is a topic for conversation, has moved the field forward in a creative and positive way. And we have put an emphasis on translating these kinds of findings into benefit for our patients. I'd like to thank each of you for coming. This is a community problem. This is a communal discussion of a very important issue that affects all of us. And finally, because there's really a lot more to say about this topic, I hope you'll join all of us at the reception that's going to follow now. Thank you very much.